So welcome all of you to a small subheading from the unit 7, that is hospital admission and discharge. We can see transfer. So transfer means shifting a patient from one room to another or from one hospital to another. So we are moving the patient from one room to another room or from one hospital to another hospital can be happen. So it's very simple to understand. We are shifting the patient. So that shifting can take place either from the bed which the patient was occupying to another bed in the same ward, or to another bed or room to another ward, or from one hospital to another hospital. So any transfer, any mode of transfer can occur. So why we need to transfer the patient from the present setting? So there can be certain reasons for transferring the patient from one area to another area. So the reasons we can see one by one. So first one is for diagnostic procedures. So the term diagnostic we have already learned. It is for any purpose of giving any test on the patient to identify what is the actual problem. So that test can be called as diagnostic procedures. So suppose the patient is admitted in the ward and we want to take an X-ray or a CT scan or an MRI scan for any diagnostic evaluations. We need to take the patient from the unit, that is where the patient is present, to the area where the X-rays and scans can be taken. So we need to shift the patient to that particular area. So that is the one type of transferring from the patient from the ward for any purposes of diagnostic procedures. Then for surgery, if scheduled, if the patient needs some sort of surgical operations or surgical opening is needed, for that purpose we need to shift the patient from the ward to the operation theatre. So that is another transfer. Then change in patient's condition. So the patient was admitted in the ward setting and we find that the patient condition is getting worsened one by one, or patient is not having adequate improvement, or the ward facility is not sufficient to hold the patient. So in such cases, we want the patient to shift into the intensive care unit or critical care unit. So that is ICU and the CCU. So in that cases, we need to shift the patient from the ward settings to the ICU or CCU. So in such cases, transfer is needed. Then for isolating the patient if required. So isolating the patient means separating the patient from other patients in the ward. So there are some cases like if any communicable disease. So communicable disease means that our present scenario we can take our COVID-19 is a communicable disease. If one person gets, there is a chance if other persons are getting into contact with that particular affected person, there is a chance for them also to get it affected. So that is a communicable. It gets transferred. The disease gets transferred to other persons. That is communicable diseases. So in such situations, if one patient is getting some sort of communicable disease, in order to prevent others from getting that disease, we need to isolate or we need to separate that particular patient. So in that circumstances, we need to transfer the patient from the actual setting to some other area of the hospital. So for that, transfer is necessary. Then another reason is transfer to other hospitals as referral or at patient's request. So transferring to other hospital means that there can be chances that our hospital settings are not enough to treat the patient, or the patient needs some additional support. In such cases, we will be transferring the patient from our hospital to other higher hospital or higher facilitated hospitals at request, or that can be on the decision of the doctor itself, or the patient can request for such type of transfers. So that is another type of another reason for transferring the patient from the hospital. Okay. So these are the reasons why we need to have a transferring of patients. So various situations where we need transferring of a patient. Now we can see what are the different types of transfers of the. So one is within the hospital. So within the hospital we have already said moving the patient from one department to another. For example, X-ray, OT, ICU or any special care units. So inside the hospital, inside the same hospital itself, we are moving the patient for any purposes of diagnostic purposes or to give additional care or treatment. Such transfers are called as within the hospital transfer. So while transferring the patient from one unit to another unit, we need to hand over all patient's documents and belongings to the transferred unit. So from which unit the patient is transferred, from there who was the caretaker nurse, she should carry all the patient documents and his belongings and shift the patient to the unit where the patient is going to stay after death. So there they should go and give to the next staff nurse in that particular area that this is the patient, his name, his number, and why was he admitted, what all treatment were carried out in our ward, and these medications to be continued. So all the details along with the patient's documents and his belongings should be handed over to the next caretaker staff in the next unit. Okay, so this is how transfers within the hospital happens. The next type of transfer we can see is transfer outside the hospital. So that means the patient will be taken out from that particular admitted hospital. So moving patients from one hospital to another may be called as referral. So such transfers when taking place or changing the hospital itself, then it can be termed as referral. Okay. So you should understand the term very clearly. Transferring the patient outside the hospital is called as referral. So that is, for example, from general hospitals to medical college hospital. That is higher advanced settings we are, or higher advanced type of hospitals we are shifting the patient. So when we are unable to manage in the normal or simplified hospitals, then we will be shifting to their multi-speciality hospitals. So that is called as the referral. So that referral means we are referring the patient. We are sending a letter along with the patient that so and so patient were under treatment here and these were the medications used and he was were managed like this, and all the details in written from the treating doctor will be sent along with the patient to the next hospital. So that is referral. Then summary of patient's disease condition, investigations done with results, diagnosis, then treatment given, etc. These all details should be there along with the patient. This is called as altogether, this is called as discharge summary. This should be given to the patient to hand over to the transferred healthcare facility for continuation of care and to avoid repetition of investigations. So this process is done when the patient is cannot be handled or treated under our hospital, and we need or the patient is in need of higher advanced treatment. We are shifting the patient from the particular hospital to other hospital. So one thing you keep in mind is that we need to, when we are transferring patient like that, we need to give all the investigations being done, what all tests have been done, all the results should be given, what all treatment we had undergone, these all details should be given as the discharge summary when the patient is transferred out from the hospital. So this is about the transferring of the patient. The transfer means we are shifting the patient from one place to the another place in the same hospital, or one unit to the another unit in the same hospital, or we are shifting the patient from the hospital to any other higher medical care center. So these are the two types of hospital and how we have to transfer the patient we have seen.